D68 is actually helping health officials prepare in the event of an Ebola case. Paul?
That's right, Janice. And the State Department of Community Health is still on high alert because of Ebola. But they look at the threat of enterovirus as being the most imminent to young people in the state. But there are lessons that can be learned from both diseases.
The partners across the state of Michigan who focus on public health and emergency response are prepared to deal with challenges like enterovirus D68 and the possibility of Ebola. This isn't a situation where we're being caught unaware.
Dr. Matthew Davis, Michigan's chief medical executive, is on high alert these days, focusing not just on Ebola as it's made its way to America for the first time, but also on enterovirus D68, a fast-spreading respiratory illness that's been confirmed in 42 states and the nation's capital.
There are hundreds, even thousands of cases of enterovirus D68, which means it's much more of a concern in terms of the numbers of people affected than hopefully Ebola ever will be in the United States.
The Michigan Department of Community Health was alerted to the threat of enterovirus D68 through its syndromic surveillance system, a network of hospitals that identifies symptoms in people who need emergency care. It's the same system that would be used to alert healthcare workers across the state in the event Ebola makes its way to Michigan.
There is daily, even hourly communication between the Michigan Department of Community Health and the Centers for Disease Control and Prevention. There is also communication among the different state departments of public health.
The main reason doctors in the state are more focused on enterovirus is because of how easily it can spread.
Because it spreads through what are called respiratory droplets, or what you might have in a sneeze or a cough.
Which is much different than how Ebola is spread.
One of the things I want to stress is that it is very difficult actually to transmit Ebola from person to person. The only way to spread Ebola is, first of all, if a person has symptoms, and second of all, if a person has symptoms and there's direct contact through bodily fluids to another person.
Again, the state isn't overly concerned about an outbreak of Ebola in Michigan, but health officials at the Department of Community Health are alert, vigilant, and prepared in the event Ebola does make it to Michigan. Reporting in Ann Arbor tonight, Paul Cicchini, Fox 17 News.
Good information, Paul, because we know a lot of people are really worried